When the MS nurse first mentioned hospice, it was quite frightening really, because I always imagined hospice as end of life care.
You think St Barnabas Hospice, you think, but having come, it's a very nice place. It's not what you expect. It's very friendly, open, and it's just having a good time.
Initially, I remember going to see somebody in St Barnabas Hospice, and obviously I think that vision came into my head at first, and so I wasn't aware of a day therapy unit. When I came, I got a big surprise.
St Barnabas is a central part in terms of managing my condition. It's enabled me to benefit from services such as physiotherapy, benefit from services in terms of relaxation, and I will hopefully go on to do other activities with St Barnabas.
It hit me very, very hard because I've worked all my life, always been very active, and it was a very nasty experience, to be honest with you. When I was discharged from hospital, obviously I couldn't live on my own, so I came to live in Lincoln with my daughter. I'm really looking forward to making new friends of my own, and they're going to be people in the same position as me. So yeah, I'm really looking forward to it.
The only thoughts I'd ever had about hospices were from where I lived previously, and I assumed that they were for cancer patients. I didn't realise that they were very good at picking up other chronic conditions. We're doing reflexology today. In therapy, you are asked specific questions or actually given homework like having a sleep diary or an activity diary. You can make vague feelings become more concrete and useful tools for changing perhaps bad habits or finding out different ways, easier ways of coping with things.
She was like a special clinical nurse manager that I had, and she referred me to the hospice. And it wasn't long before I heard from them, and I came along and had an assessment with the nurse here, one of the nurses here. I've had physiotherapy for my chest because I have bronchiectasis as well as multiple sclerosis. I've had relaxation. Going to be put forward for the Tai Chi. But it's like, I don't know, it's like a family here as well. The staff are so friendly. There's always support there if you're feeling a little bit down. They do recognise it.
Often people come to us perhaps in a stage of crisis. They've been referred because they've hit a bump in the road. Their circumstances have changed, they've maybe become more poorly, they've maybe just finished some chemotherapy and they're feeling particularly rotten. And we can offer these services to pick them up, to set them straight again, to put them on the road to seeing that there's more that they can achieve. It is a rehabilitation, it's getting used to a new way of viewing their life, but of living their life to the full. So yes, the services, even whether it's physiotherapy exercises or whether it's some gentle complementary therapy, they're all of equal value, and they all help to pick up the pieces, as it were, and help them live their life.
To me, I feel quite emotional thinking about it. They were there when they threw me a rope, and I was very glad to hang on to the end of it.
It's helped with my life overall. I feel a lot better, and my health and everyday life is a lot better with coming to St Barnabas.
It's helped me to get out much more and live instead of just existing, which is what I was doing.
Country roads, take me home to the place I belong, West Virginia, Mountain Mama, take me home. Country roads.